Hello everyone, my name is Dr. Jacobs. I'm a doctor of physical therapy and I'm an inventor of ASTR specialty. I'm also a cancer survivor and I used to suffer from chronic migraines, headache, pain and fatigue before I invented ASTR specialty. Right, Reza, tell me what's going on with your foot. What happened?
Well, my left foot is all in the pain. I think it's off balance. I've lost the harmony of the walking and doing day-to-day activity. When I walk on the hard floor, I get pain on the plantar fasciitis.
Okay.
And pain is moving. Sometimes it's in the metatarsal, sometimes it's in the back of the heel in this region. And also I got tightness on the calf muscle.
On the calf muscle.
Especially I wake up in the morning.
How long has this been going on?
It's been 2 years.
2 years. How did you hurt yourself?
I think I started doing elliptical and then hip clicking and then I did knee surgery. I was ignorant about all of those and I continued doing my exercises.
Walking funny. Yeah.
I didn't stop my exercises. I was doing every day a different type of exercise. From power yoga, cardio, Pilates and all of those.
Okay. So, for the last 2 years, what kind of treatment did you have?
I started physiotherapy on my knees and then it didn't help. It helped a little bit, but then
the pain comes back
again.
Temporary? Okay.
And then I saw a chiropractor doing PDTR technique. And
reflexes, okay.
And then I also at the same time I realized that it's better to combine and I saw two chiropractors at the same time. One is working on the ART method, the other one was working on the PDTR. After a while they couldn't help, but I've got some indications that I might have digestive issues. Then I started functional medicine and running tests and changed my chiropractor as well. Okay,
so you basically tried everything.
Yeah, I'm ready.
Except ASTR. Okay. So all right. So we want to aggravate your symptoms now.
Okay.
Okay. So what we can do to make it worse? You're going to focus on your foot for now. For
walking on the hard floor, it is more aggravated in the morning. But
in the morning, the first few steps.
Doing the stretch, I think I did some, and I started getting some complaints.
So how much pain do you feel at worst from 0 to 10 in this emergency room?
Now it is at the level of 3 to 4.
You feel it just sitting now 3, 4?
Yes, yes.
Okay.
Yeah.
So we'll have you walk, and I want you to tell me if that increase or is still the same 3 and 4.
Okay.
But you have the classic symptoms of plantar fasciitis, pain increase in the morning or after resting, increase in a few steps. Yes. Okay. So we'll have you walk outside and back and forth, and then you let me know how much pain.
Okay, sure.
Back and forth. We're definitely going to work on your gait, the proper way of walking.
Yeah.
So we'll show you that. Did anyone show you how to walk properly?
Yeah, they worked, and basically I need to use my spine and the hip to kind of like walking like Steven Seagal. I don't know.
Okay. Well, we'll show you a different way of walking. So how much from 0 to 10?
In fact, it is staying still at level 3. Yeah.
3, okay. And where do you feel it exactly?
Partly here, and also my middle toe.
That toe. Yeah. Let's do heel raises and tell me if that aggravates your symptoms. You can hold on the wall if you want.
Okay. Yeah, okay.
Does that make it worse or is it the same?
Still, it is the same.
It's the same. Okay. All right. So we'll have you lie on your stomach. So you feel it right here?
Yeah.
All right. So is that painful what I'm doing here?
Yeah, it is. It is all, yeah, almost there.
Is that painful what I'm doing?
No.
Okay. So you said you feel it right in here.
Yeah.
And you feel it in this toe, yeah?
Yes.
Okay. Okay. And you said your calf is tight?
Yeah, I mean that when you touch that mid calf, I felt some pain.
Yeah, you feel those knots?
Yes.
That's a scar tissue. You feel this bump here? That's a scar tissue here. And this is the hip that clicks. Is that right?
Yes.
Okay, so we're gonna work on that next time. We'll just get working on the plantar fasciitis first. Is that too much?
No, it's okay.
Make sure it's not painful, okay?
Sure. This is painful.
Sorry. Mm-hmm.
I can stand for the pain, just let me know.
I want to make sure not to cause pain because that will cause inflammation and will make it worse.
Okay.
So pain, it's like a check engine signal in your car. Signal light. So if you have that light on, you have two options off. Oh, only. One is cover the light, hope for the best and keep driving. I really don't want to drive with you this way. Two is stop the car, fix the motor, and the light will disappear.
Okay.
So if you feel pain, that means there is some issues inside, and if we push it, if you have a minor tear, you could cause a major tear. So that's why we want to make sure to avoid any painful treatment. How's that?
It's painful.
Sorry. So I'm not gonna work on the inflammation now. I'm just gonna work on the tightness.
Okay.
To rule out if you purely stuck in the proliferation stage or going back and forth between proliferation and inflammation. So I want you next time, if you have other shoes, bring all your shoes or orthotic. I will take a look at it, okay? Is that too much?
That's fine.
Okay. Did you have any like numbness or tinglings in your feet?
Not now. I think it's painful when you're in that pointy object.
That's fine, that's spot, okay. Okay, it's gonna feel cold and I will show you the scar tissue here, okay?
Okay.
You feel this bump here?
Yeah.
You see that? Stuck. That's a scar tissue. Feel that? So why scar tissue could be an issue? Because the muscle should act like a rubber band. When it contracts and relaxes, it should stretch like this. When you have a scar tissue, it's like you have a knot in the rubber band. So when the muscle contracts, it does not stretch much. And that's why you feel tightness. Unfortunately, based on the study, exercises and stretch, based on at least 6 systematic reviews, does not really help with the pain. And think about this way, if you have like a knot in the rubber band, if you stretch it, is that gonna release the knot?
No.
Nope. So why we do stretching? We have to really get rid of the knot and the rubber band will be more elastic.
Okay. Good.
Does that make sense?
Yeah.
And you can see here, that's why you said you had a PT, you had a chiropractor, active release, technique, ART, and reflexes. And we want to make sure to treat the source of the problem instead of the symptoms. And you feel the scar tissue here?
Yeah.
Okay. So if there's no scar tissue, it should feel like nice and smooth like this. Can you tell the difference?
Yeah, different.
Okay. Painful or it's okay?
It's okay.
Okay. I'm gonna show you the scar tissue here. That's usually feel like a grain or grinding. It's not too bad actually here. You feel that like kind of like sand. That's a scar tissue. I'm gonna give you exercises for your arch after the video, okay? To correct your arch, and I'm gonna go over where you put the weight in your feet to really decrease your risk of having this in the future. So this is a spot you felt it, is that correct?
Yes.
So we'll give you some more. We'll have you sit up, and because you said you when you're just sitting, you were feeling the pain, and actually you felt it with walking. So Let's have you sit up and drink some water. Do you feel pain now or it's gone?
I feel some form of pain because of rubbing.
How about let's drink more water?
Still, I feel no pain in this region and also here.
How much from 0 to 10?
I would say no, it's at 5.
5. Make sure when I'm working on it, you tell me so we don't cause inflammation. Let's drink more water. Make sure it's pain-free. I will have you lie in your stomach and I'm going to do some stuff for inflammation, okay?
Okay.
Any pacemaker or seizures or anything like that? Yeah?
No.
Okay, so let's lie in your stomach again. So you said you feel it right in here?
Yes.
Okay.
And all the heart.
And here? Okay. Do you drink enough water?
Yeah, I try sometimes I forget, but I try to drink
So did you drink
5
enough?
bottles of water.
Did you drink enough today?
I would say no.
Okay. Make sure to drink more. Okay, let's sit up, drink some water, and tell me how that feels. And tell me how you feel now.
I feel it in this region.
Pain or itchy?
Itchy.
How much from 0 to 10?
7.
The itchiness?
Itchy.
You can scratch it.
Yeah.
I will scratch it for you. This is the
Yeah.
area? No, I'm not going to scratch it. We'll just work on increasing the blood flow and decrease any inflammation here, okay? So if it's mild inflammation with the Magna Hail, it should be enough using it for a few minutes here. So I want you to make sure to keep track how long you feel better after the treatment, because that will help me to know, do you have inflammation or you don't have inflammation? If you have inflammation, how bad is your inflammation? Is it mild, moderate, severe? So usually we know that relaxed based on how long you feel better after the treatment. So if you feel better 3-5 days and everything is calm, just take a few treatments, clear up everything, and that's usually you stop purely in the proliferation stage. So it's important to know how long you feel better. Okay, let's drink more water and we'll get you more water.
The term proliferation, so what was that?
So the body has to go through 3 stages. Very good questions. So the body has to go through 3 stages in order to heal. Again, I use external paper cut for visualization. But the same process happened internally from accident, trauma, or any injury. Okay? So, so I use the paper cut so we can visualize what's happened inside. So the first stage of any injury, like any musculoskeletal injury, like plantar fasciitis, knee injury, back, shoulder, or any inflammatory inside the body diseases, the body has to go through those 3 stages. First stage is inflammation, swelling, redness, and the blood start to rush to that area, okay, and pain. Second stage is a proliferation stage. That's when the body starts to build the scar tissue. So if our body does not build the scar tissue, it's open wound susceptible for infection.
Yeah.
Okay? So, and there's a cascade of events happen here. I'm going to go over the scar tissue for the sake of our time, but if you have any question, I can go over this in a later time.
Okay.
Okay? So in perfect scenario, actually during the maturation stage, the body gets rid of the scar tissue and everything clears up. That did not happen with you.
Yes.
You have 2 years of the same issue. So that could take days or weeks or months or years to really clear up everything.
Yeah.
Why scar tissue could be an issue? Because our muscle should act like a rubber band. When you contract and relax, it should stretch like this. When you have a scar tissue, it's like you have a knot in a rubber band. So when your muscle contract, it does not go further. And you felt all those knots and you complain plantar fasciitis and calf tightness. Unfortunately, stretches and exercise is not going to break the scar tissue. Manually, we have to break. That's why you had a physical therapy, you had stretches, you did exercises, yoga, and nothing lasts because they actually stretching the band. You have to have mechanical force to break the scar tissue and also mechanical force to release the fascia. That's why you have tools to release the scar tissue, other tools to release different layers of fascia, because we have several layers. So scar tissue very essential for survival. We need that, but too much of that is an issue with a lot of conditions. So if you feel better after the treatment for 3-5 days, we're just gonna need few treatment, clear up everything. We'll go over your ergonomic behavior modification to make sure that you don't do anything in the future that to trigger that.
Okay.
That mean you stuck purely in the proliferation stage. If you feel better after the treatment for half an hour to an hour, and your pain comes back the same, that's mean you have severe inflammation. So the time frame, how long you feel better after the treatment, extremely important to know what to do next. Because you could have mild, moderate, severe inflammation, and each one I have a different protocol for it.
I see.
So that time frame will help me to narrow down what we're gonna do next. If you don't have inflammation, we're done.
I see.
If you have inflammation, we have to do a little bit more investigation, like doing the nutrition analysis and doing other stuff to figure out why your body is not healing.
I see.
So it's either you're stuck here in the proliferation stage, or you're going back and forth. Because it's never going to be only inflammation. Your body has to go to proliferation, but the inflammation causes proliferation causes inflammation. It's a vicious cycle. So that's what we try to do in each, like especially the first session.
Okay.
All right, so let's walk and tell me how that feels from 0 to 10. How's that?
I'm trying to.
Any pain?
Yeah, same region.
How much from 0 to 10?
Same level that I had before.
Mhm.
2, 3.
Where do you feel it exactly?
In the metatarsal region.
In the metatarsal?
Yes.
You feel it deep inside? Okay. So let's have you lie in your stomach.
Okay. Yeah.
So do you feel it a band or a spot? What do you feel?
Yeah, I feel just the middle toe at the back in this region.
So it's a spot or
Spot, yeah.
Okay, let me work on that spot. Okay.
And yeah, I think that's it.
So it's a shrink, is that correct? The size of the area of the pain.
Yes, yes.
Okay, that's what I'm looking for. Okay. So let me get to the exact spot. Is this the spot? Is this the spot?
Yes.
Okay. Okay. So do you see what I'm doing now? So you could have inflammation everywhere and just one spot more inflamed than anything else. That's why I try to figure out what to do or where is the exact spot to really be intentional about working on the inflammation on that spot. Is that too much?
No, it's fine.
Mm-hmm. Okay, let's drink water and try it again. And I'll have you walk back and forth and let me know how that feels. How's that?
It's less pain.
0 to 10?
Around 1 to 2.
On the same exact spot?
Yes,
So if it's a little bit on the moderate
Yes.
inflammation, let's lie in your stomach again. So if it's a really mild, it should be like a few minutes with the magna here, but let's actually work on it more. So in that spot, the same spot, yeah?
Yes.
Okay. You feel warmness there? Yes?
Not yet.
Okay. Am I on this exact spot?
Yeah, a little bit closer to toes.
Like here?
Yes, yes,
And here, yeah, okay. So I'm on the right spot now, yeah?
yes.
It's not the wrong foot?
No.
I'm just joking. Wrong patient. Okay, try to drink more water before you walk and tell me how that feels. And the calf tightness, when you walk, did you feel it? We'll have you walk and tell me how's the calf tightness too.
Not that much, but when I try it now, I feel a little bit of tightness.
Okay.
And the other thing is that on top of mid-toe, when I bend it like this, I feel that the string is being kind of pulled.
It's a pulling?
Yes.
Tightness.
Yeah.
Pulling, not pain.
Not pain.
Okay.
Okay.
Let's drink some more. Because you said that, you're going to do one more thing, okay? Okay, a little bit more. And we'll have you lie on your back. And when you feel that, like, it's pulling here, tightness here now. Make sure what I'm doing is not painful, okay? Do you still feel it? Do it now. Where's it gone?
Yes, yeah.
You feel it?
Yeah.
You do?
Yeah, I do.
Okay, relax. I'm gonna work on inflammation here. So it's inflamed in the bottom and the top.
I think it's more the bottom.
More on the bottom? It's just a little bit tight on the top?
And on the top it looks like it's a strange feeling. It looks
It's
like,
like a
there
band.
is a small string that is going through the toes, and when I'm bending,
Yes.
I'm pulling that
That's the
string.
word you described, like
Yeah,
when your rubber band has a knot,
yeah,
the band is not stretching because
Yes.
muscle should act like a rubber band,
I see. Okay.
you know. So tightness is not my concern. It's just a few treatment and that should be okay.
Yeah.
My main concern is the pain. Okay.
Okay.
So you're gonna continue feeling tightness until we clear up everything, and I need to work on your head because that might
Yes, yes, yeah.
affecting it indirectly, like compensation and stuff like that. So
When I was laying face down, I also felt some kind of pain or agitation at the head of the hamstring, in the sit bone area.
yeah, we're gonna work on that. Yeah. Okay, so let's drink more water and stand up and tell me how that feels. You can move it and tell me how's the tightness there. Drink more water.
I get some indications, but it's better.
It's not as tight.
Yes.
Okay, so let's walk and tell me how's your... How's that?
I don't get pain that much.
So the pain is gone?
Yeah, I mean I feel some kind of dryness in the arc.
But no pain, just tightness. Well, you know, you still have some scar tissue,
Yes.
so it just take a few treatment to clear it up.
Yeah.
But as long as you don't feel pain, that's what I care about. You need to subscribe to my channel to get helpful tips on how to relieve pain and watch real treatment videos. There are over 45 studies that support ASTR treatment model. If you are a patient and would like to schedule an appointment or treat yourself at home, check the link below. If you are a healthcare provider and would like to receive ASTR training and buy ASTR instrument, check the link below. See you soon!